This is what we are going to be doing as doctors, is having those tough conversations with families and helping them navigate what the best thing for themselves and the patient is. What is up, everyone? Welcome back to the channel. For those of you who don't know me, my name is Jordan and I'm a first year medical student in the state of New Jersey. So it is the 6th week of our current block. We're starting the female reproductive system. So Monday we did some histology and learned about the female hormone cycle. And Tuesday we had a refresher on female anatomy, and we did a pelvic imaging lecture, and then finally learned about cervical and ovarian cancer. One really cool thing I want to talk about that actually happened this past weekend was it was my first time in the hospital. So my school has a longitudinal clinical experience where we're matched up with one doctor in the community. I'm matched up with an internal medicine doctor who mostly does outpatient stuff, just primary care. However, like maybe once a month, she does rounds at the hospital. So my first few visits were just in the outpatient clinic, but I thought it would be a really good experience to go in the hospital and see what that's like. So I went this past Saturday. Got there around 9 o'clock, nothing too crazy. I was kind of scared that she was gonna be like, all right, let's get there at 5 a.m. to pre-round, but it's a little more chill when it's on the weekend, and it's just kind of like her schedule. So she was like, yeah, I'm gonna get there around 9, so it wasn't too bad. So basically how it worked was we walked in, she had a list of patients that came there overnight, pretty much through the ER, and it was her job and our job just to see those patients, and then you could pretty much go home once you saw them and made a plan. That was the first big difference to me between outpatient and inpatient. So in outpatient, it's like you're going to see your PCP just for a well visit, your yearly checkup, whatever. And, in that setting, everyone has a specific appointment time, 1 o'clock. You show up at 1 o'clock. Hopefully they're not super behind. You're seen. Usually takes like 15-20 minutes, and then you're out. And from the doctor's perspective, like they have patients at 1:15, 1:30, like back to back to back to back, so you kind of have to keep things moving so you don't get super far behind. In inpatient medicine, though, it's a little different, where at least my one experience I had, we had this list of patients and it was just our job to get those done however quickly or slowly we wanted to. So that was pretty cool because some patients were very quick. They came in for chest pain, stabilized them, they're feeling great today, we can discharge them, like quick in and out. But then some patients were a lot more complicated. We had to really talk about what was going on, what tests we still wanted to run, how many days we wanted to keep them, what antibiotics we wanted to start, all that kind of stuff. So that is the one benefit of inpatient, to me at least, is you can kind of allocate your time more appropriately instead of just like having 15 minutes for one patient no matter what they have going on. All right, what's up, everyone? It is Sunday night. Just to quickly update you on the week. Thursday and Friday, we finished up some of the female reproductive system. We had sessions on contraception, menopause, abnormal uterine bleeding, and then finished off the week with a lecture on early pregnancy and the possible complications that can happen. So all that was really interesting. It's nice to sort of just focus in on one system, like we have been doing these past few weeks. And then next week is our last week of the course, and it's still just more about the female reproductive system. I wanted to talk a little bit more about my experience in the hospital. And, I already talked about the sort of logistical difference between inpatient and outpatient that I noticed, the whole scheduling thing where in inpatient, you just have a list of patients that you have to get through versus outpatient. It's more like very regimented, like you got to get your patients in and out in 15 minutes so the next one isn't waiting. But this next difference is more to do with the patients themselves. As you would sort of expect, someone who is walking into an outpatient clinic for a yearly checkup, get some blood work, get a physical, whatever, they're relatively healthy. But people who are admitted to the hospital and on a internal medicine floor, they're not very healthy. They're pretty sick. And it sounds simple when I say it like that, but it sort of threw me off when I, went and saw my first patient. My doctor was like, all right, here's a list of patients, like pick one and just go see them. It was really my first experience going and seeing a pretty sick patient alone. This one patient I saw came in with chest pain, had a very long history of heart disease, diabetes, very long list of conditions, long list of medications. And it was a little jarring walking into a hospital room and just seeing someone who is fairly sick, and you can tell that they're just uncomfortable and they don't want to be there. So it was a little hard for me at first to be comfortable with, doing my job, asking the questions, seeing if they're all right, asking what medications they were given when they got to the hospital. Honestly, a lot of the patients we saw had no idea, so I would have to go and talk to the nurses or try to look something up in Epic. So yeah, all in all, just like a very different experience from outpatient. So I'm very happy that I chose to do that, even though it was a Saturday. I could have been studying, whatever. I was like, this is probably going to be a good idea to see this side of medicine beforehand, because in rotations, it's more heavily inpatient stuff as opposed to outpatient. So I wanted to get that experience so I'm a little more comfortable even before rotations start. And going along with the two differences I've kind of mentioned, the scheduling thing and the severity of illness, I had my first experience with like an end of life conversation with a family. The patient was very old, I think around 90 years old, had a lot of comorbidities, pretty advanced dementia, and they were in the hospital for an infection. So we basically had a very long conversation with the family, what we thought the chances of recovery were, what recovery would even look like, kind of getting into the quality of life conversations. Talked a lot about hospice, what hospice's role is, when you should sort of start that process. So I learned so much from that conversation. It was hard, but this is what we're going to be doing as doctors, is having those tough conversations with families and helping them navigate what the best thing for themselves and the patient is. And as you can imagine, this was a very complex, long drawn out conversation. So the fact that we had the inpatient scheduling system means we could allocate a whole hour to talking to this family without getting super behind on all of our other patients. So all in all, I'm very glad I chose to go in the hospital last weekend. I'm hoping to do it a few more times just so I'm a little bit more comfortable and it makes the transition rotations a little bit easier. Alright, well that's going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I'll see you in the next one.